Dear students, welcome back. In the previous session, we have seen the surface marking of the cardiac walls and the auscultatory areas. Now we are going to see the applied anatomy of the valves of the heart. So in the applied anatomy, we are going to see the heart sounds and some of the pathological conditions which causes some diseases. So how it happens, we are going to see in this thing. So in the applied anatomy, the heart sounds are mainly produced by the closure of atrioventricular valves as a one set, and another sound is caused due to the closure of semilunar valves. Okay, so here you can see this one is the atrioventricular valve, right side and left side atrioventricular valve. Here there is a closure of these two valves, and here you can have this pulmonary valve and the aortic semilunar valves. These are the four valves present in the heart. So there are two heart sounds. One is the first heart sound and the second heart sound. The first heart sound is called as systole and the second heart sound is called as diastole. How this first heart sound is occur? So it is occurred due to the closure of the atrioventricular valves. Here you can see the closure of right atrioventricular valve and the left atrioventricular valves. So by the closure of the atrioventricular valves, you can hear the first heart sound, that is called as systole. And next one is the second heart sound. This one is produced by the closure of semilunar valves. This is closure of semilunar valves. This sound is called as diastole. So when the atrioventricular valves are closed, the semilunar valves are open and the blood is pumped to the pulmonary trunk and the aorta. Whereas in the closure of semilunar valves, the blood enters from right atrium and the left atrium into the right ventricle and left ventricle simultaneously. These are the two heart sounds which are heard during the beat of the heart. Okay, this is the one of the applied anatomy of the valves of the heart, and the next one is the condition. The one is the narrowing of the valve orifices due to the fusion of the valve cusps. So such condition is known as stenosis. What do you call? Stenosis. Narrowing of the valve. Here you can see the valve. This is the mitral valve where the narrowing of the valve orifice. So here there is no complete opening of the valve. Here we can't see here. So this causes some fusion. How it occurs means it is due to fusion of valve cusps. So we are having this two cusps are going to fuse with each other, forming the narrowing of the valve opening. So the opening is going to be narrowed. That means it is going to decrease its size due to the fusion of the cusps, valve cusps. Such condition is known as stenosis. What you call? Stenosis. If it occurs in the mitral valve, then it is called as mitral stenosis. Okay. So what happens in the mitral stenosis? Narrowing of the valve orifice, that is the opening, due to the fusion of the valve cusps is known as stenosis. So some of the stenosis are the mitral stenosis and the other one is the aortic stenosis. Here you can see this aorta, the valve, how the valve is the semilunar valves here. So you can see here the fusion of the some extra thing which is going to be occurred due to the fusion of these walls. So this is the actual wall, but the extra growth you can see here, that is the fusion of the walls, which decreases the size of the opening of the aorta here, and the flow of blood is from ventricle to the aorta is decreased because the narrowing of this wall. Such narrowing is called as aortic stenosis. Okay, so one is the mitral wall stenosis and another one is the aortic stenosis. And the next other condition is called as the regurgitation. What do you call regurgitation? So this is occurred due to the dilatation of the valve orifice or stiffening of the cusps causes imperfect closure of the valve leading to the backflow of blood. Normally these valves maintain only the unidirectional flow, isn't it? So here what will happen? It causes send back to its atrial cavity or the ventricular cavity because of this dilatation of valve orifice or stiffening of the cusp. The cusp will not close properly. Here this is the normal one. Here you can see the closure of the valve very clearly. So complete closure of mitral valve we can see here. But here the valve is not closed properly. So whenever the ventricular contraction is taking place, so here the valve is ballooning more into the atria, and also here there is an incomplete closure of the valve we can see here. So the blood will again go back to the atrium. Such kind of imperfect closure of the valve which leading to backflow of blood due to the dilatation of the valve orifice. That means here it is increasing the size of the opening or by the stiffening of the cusps. So such condition is known as incompetence or regurgitation. What you call incompetence or regurgitation. Competence means I have already told that capable of performing the normal function effectively. Here the valve is not capable of functioning normally here. So this is known as incompetence, and the valve here you can see the valve is maintained at this level. But here in the mitral valve regurgitation, what is happening? The valve is going back to the atrial cavity. So that is one is called as regurgitation. So such condition is known as mitral incompetence or mitral regurgitation. This is the condition where here the mitral valve is incompetent. So the condition is called as mitral valve regurgitation. And the another condition is the aortic incompetence or aortic regurgitation. Here you can see here the aorta in the normal heart. So here how good the valve is closed here. But in the case of regurgitation, here there is no closure of the valve, and here the orifice is the size of the orifice is increased. That is called dilatation of the valve orifice, which causes again the backflow of blood from the aorta to the ventricle. So such kind of condition is called as aortic incompetence or aortic regurgitation. Okay, these are all about the applied anatomy of the valves of the heart. One is the heart sounds, first heart sound and the second heart sound. And next one is the stenosis, mitral stenosis and the aortic stenosis. And next one is the regurgitation or incompetence, in that mitral regurgitation. And next one is the aortic wall regurgitation. Okay, so the causes may be so many causes for occurring such kind of conditions. Those things you people are going to study in the clinical cardiothoracic subject. Okay, so in the next session we are going to see the conducting system of the heart. Thank you.